Hi, I'm Mohamad Mohty from the Sorbonne University in Paris, in France, and it's my pleasure today to give you a brief summary of what I viewed as highlights of HATCH 2020 in terms of graft versus host disease. I think this first virtual HATCH 2020 annual meeting was absolutely fantastic. We have seen lots of interactions, and although we are all missing the live in-person meeting and interactions, actually we still managed to have a lovely event which was actually full of advances and innovations. When I consider and focus on the GvHD topic, of course, it can take hours to summarize and highlight all the findings from ASH 2020. For the sake of time, I thought to select two issues, two topics, which, in my opinion, are going to make very soon an important difference, I think, in the way we manage and handle chronic GvHD. We all know that chronic GvHD, especially corticosteroid refractory chronic GvHD, is truly an unmet medical need. We were fortunate enough 2 or 3 years ago to have ibrutinib being approved based on a relatively small phase 2 single-arm trial, but the drug was not and is not available or approved everywhere. So this is why there was still room for further development. And this is why I thought that the presentation as part of this ASH 2020 of the results of the REACH-3 trial. So this is a trial comparing ruxolitinib versus best available therapy in patient with steroid refractory or steroid dependent chronic graft versus host disease. That was a phase 3 randomized trial. Patients were randomized 1-to-1, either received best available therapy, steroid plus or minus calcineurin inhibitor, or the experimental arm was about treatment with ruxolitinib, 10 milligram BID steroids plus minus calcineurin inhibitors. We had 165 patients in the ruxolitinib arm and 164 patients in the control arm, best available therapy. Obviously, it's a randomized trial, so patients were quite balanced between the two arms. And the key finding is about the primary endpoint, which was achieved, and this is the overall response at week 24, 49.7%, almost 50% CR and PR in the ruxolitinib arm versus 25.6%. And that gives you an odds ratio of 2.99, and this is statistically highly significant. The other piece of information which makes me quite enthusiastic about it is about the failure-free survival at week 24, and actually that was not reached for the experimental ruxolitinib arm, whereas this was 5.7 months for the control best available therapy arm. That gives you a hazard ratio of 0.37, and this was statistically highly significant. So I think based on these results, and similar to what we have seen recently in the acute steroid refractory refractory GvHD, I think ruxolitinib is making its way nicely in the steroid refractory chronic GvHD. That was the ruxolitinib story. However, during this ASH 2020 meeting, I have also seen a very attractive study. This is the Rockstar study, which was presented by Dr. Cutler from the US. The REACH3 trial was presented actually by Dr. Zeisser from Germany. And this Rockstar study is actually an open label study which has used a novel agent, a newcomer with a new mechanism of action in the field of GvHD. And I believe you will remember this for many years. This is belumosudil. Yeah, we need to learn how to pronounce it, belumosudil. And interestingly, the trial was very attractive. It has included 132 patients. There was 2 doses, 2 ways of administration were tested, 200 milligram QD versus 200 milligram BID. Safety and tolerability were absolutely very good and consistent with what you would expect in this heavily pre-treated population. And at the last follow-up analysis, when it was presented, the primary endpoint of this study was met, and the experimental drug belumosudil achieved a clinically meaningful and statistically significant objective response, overall response rate in both arms. And that was more than 70%, 73 and 77%. So clearly, in summary, I would say these are really very good news for the transplant and GvHD community, and things are really moving in the right direction with the advent of these 2 new agents in this area.